Joining me now is Ogun State Commissioner for Health, Dr. Tomi Kuka. Good morning.
Good morning.
Thank you for joining us at TVC Breakfast. Before we go to the rising cases, you have been at the forefront of championing the cause of the state towards curbing the spread of COVID-19 within the states. That's Ogun State. Talk to us how things have been playing out with regards to that effort.
As you know, I resumed work on the 20th of December, and exactly 8 weeks later, I found myself in a pandemic.
It must have been a tough call.
It was interesting. The journey has been interesting so far, given that prior to this, I was a gynecologist.
Oh, wow.
So becoming a public health physician in eight weeks has been an interesting journey.
Right.
But saying that, Ogun State has responded quite, proactively, in that the index case having happened on the 27th of February. We swung into action and we quarantined the 40 contacts of the index case. And
you were able to easily trace the contacts as quickly as possible.
We were, because it happened in an industrial environment, and we were able to isolate them within that premises, which meant that we didn't have anyone that was a contact that we were not able to trace. So we had 100% contact tracing, kept them in for 14 days for observation. As you well know, during that period, one of the contacts did test positive and subsequently was discharged a few days later when he converted to being negative. We then had a lull of about a couple of weeks before we had a next case, which was case number 3, who also had one contact that became positive. So the case scenario that's playing out for us in Ogun State is that, we do know that coronavirus is contagious and on average would be transmitted, one person would transmit it to an average of 3. But in Ogun State, what's playing out is one person is transmitting it to another person. So our curve is undulating, really, really slowly rising. And in the last 48 hours, we've had a 150% rise in our number in the last 5 days. And we're wondering, because if you go with the expected case scenario that one person would infect 3, we would expect that we should have had 85 people tested positive. So far, we've only had 9 in Ogun State. So it's raised a bit of, concern in that, are we not testing enough? And if we're not testing enough, what can we do to increase our testing? So as a state, my governor, His Excellency Prince Dr. Abiodun, actually we've procured 2 molecular labs to help us increase our testing capacity, because one of the challenges we've had is the turnover time, because we were sending our samples to reference labs in states around us. And during this lockdown, if you look at the countries that have actually succeeded in flattening the curve and being on the downward trend, particularly South Korea, one of the 3 success factors that they had was during the lockdown, they increased their testing, capacity to test. They also did social distancing, ensuring that people did stay home. And also they built capacity within their healthcare workers.
But what is the capacity at this time as we speak for Ogun State? What is the capacity to test per day?
Well, prior to us getting the molecular lab, we actually were relying on other states. But since getting that molecular lab, from Monday, we'll have a capacity of up to 1,000 a day that we could do. So as the DG for NCDC has mentioned, the challenge now will not be the lab capacity, it will be the individuals to go out to actually test. But we are training staff, medical personnel, to go out there during the lockdown. As you well know, that the president recently extended the
lockdown.
So we're going to maximize on that and go into our vulnerable communities, which are the communities that border Lagos State, which is Obafemi Owode, E4. And we also find that around the border, we have one international border, and that is around Ipokia, Yewa South. We also have cases coming from there. So those 6 local governments that we've found cases, we're going to concentrate on them and do a bit more surveillance.
So it means that there are tendencies for cases to rise as time goes on, when the testing capacity increases, like you have said, from Monday, perhaps.
Definitely.
So what is the capacity for isolation centers as well? How do you isolate those people when the cases rise?
Currently in Ogun State, we have 4 isolation centers, and in total we have 310 isolation beds with 20 ICU beds and 24 ventilators. So the capacity is there. And the model we've used in Ogun State is we have what you call model schools structures, which were not in use. So we're going to use that model. If we have to scale up, we've identified, you know, those model schools that we could scale up into, or event centers in every local government. Every local government chairman has been given the task to identify a space within their local government where we could scale up easily. And so we have, we've been stockpiling equipment and PPEs to ensure that should the case arise that we need to scale up in a very short time, if there's an outbreak, we could do that.
Okay. Another issue that has been of a major concern to a lot of persons is healthcare workers, the capacity, if you have them at hand, to really drive the efforts of government. Because even in the UK and some other countries, you see there is collaboration between state hospitals and private hospitals as well. Is that a model that Ogun State is looking at?
Yes, we've engaged all the private hospitals, proprietors. We have a tertiary center, which is private as well. We've engaged them, and also the Federal Medical Center. So we're working as a state rather than as a state hospital. We're recruiting from the federal government staff within Ogun State, the Babcock University staff, they're engaging with us, and all our general hospitals. We've actually stopped routine cases, operation and clinics. We're dealing with emergencies only. But we continue to see antenatal patients and immunization, because that's another thing that is falling out of this, is that women are not turning up for immunization, and cases of measles are going up. So we are encouraging our pregnant women and mothers to bring their children for their routine immunization, because we don't want to finish the COVID outbreak and then go into an outbreak of measles and other diseases.
All right, one last question before we let you go is the number of cases in Lagos is increasing. And you know, Ogun State and Lagos have this close proximity. I wonder how much of a concern that is for you with the fact that so much effort from what you have said is being put in place to check the spread of the virus. Are there concerns that it might spill over into Ogun State? We're
very much concerned, and so our efforts has been to concentrate on our surveillance. We've increased our surveillance by deploying a mobile app where people can do a self-assessment in the comfort of their homes, and you could be stratified into mild, moderate, or high risk. The high risk group are actually lit up as red, flagged up as red on our dashboard in the ministry, and we pick them up, and the state epidemiology team go in and assess the individual further, and where necessary, we actually test them, do the swab test. We are not using the rapid kits, we're using the swab, nasopharyngeal swabs, to ensure that we are testing for the genetic component of the virus in people. And we are training more people to go out into those border communities with Lagos, as I mentioned, to conduct as many tests. We have capacity as I said, for over, probably we'll be doing over 300 tests a day come next week.
All right, we'll leave the conversation here now. Dr. Tomi Kuka, thank you so much for speaking with us.
Thank you.
Well, joining me now is Ogun State Commissioner for Health, Dr. Tomi Kuka. Thank you for joining us on TVC Breakfast.
Good morning.
Before we look at social distancing, I'd like for us to quickly talk about how the state is perhaps exploring technology to address curtail the spread of COVID-19, as we see in some other countries that have come up with developed apps, phones. You have different ways that they are trying to see that people can easily test and also check for if they have the symptoms and the likes.
Right, so in Ogun State, as soon as we had the first case on the 27th of February, we realized that we had to reach our healthcare workers very quickly in a short time period without having to expend a lot of resources doing that. And so what we did was we got a technology firm, Instrat, to develop a platform for our healthcare workers to actually disseminate current up-to-date information from the NCDC and WHO right to every primary health care worker, particularly in Ewekoro local government, where the first case was masks, because those are the first line of contact for patients. Then, as we screen patients, the level of PPE increases, and for people working in the isolation center, they have the PPE kit, which includes the suit, the shield, the goggles, and the boots. We've been lucky enough to have donors. A lot of donors have been donating PPEs, and the state itself has acquired quite a large number of PPE. As I said, we've been stockpiling to ensure that our healthcare workers, we've actually also included the private hospitals. We've distributed items to try and support them, because we do know that they will be challenged. Given that there is a lockdown, there will be less traffic into the hospitals, which means earnings will be reduced, and these things are costly.
Let's focus our attention now on social distancing, because that is one of the key ways that it's being promoted as helping curtail the spread of COVID-19. Despite championing that, we still see an increase in a number of cases, a number of infections across states where there are lockdowns. Lagos, the numbers keep rising. And a lot of persons have questioned if social distancing is really Afrocentric to really deal with issues, looking at our society as being very communal. Is there going to be an option if social distancing is not really as effective as some are looking at it?
Well, social distancing has been proven in other climes to be effective, probably because of the way of living, the accommodation. In Africa, we're quite communal, and it's not uncommon to have 3-4 people living in the same room, which means we are challenged. However, it's not the end of the world to have that situation. I think the other way we can actually address this is given the directive that people should put on their masks, because we know for fact that even an infected person will not be able to transmit the virus if they have their mask on. So if we have a mass declaration that everyone should wear a mask once they're in the public, in Ogun State, that is what His Excellency, the Governor of Ogun State, has actually declared, that when you're in the open, when we have the 48-hour respite period, everyone, when they're in the public, should wear a mask to prevent themselves infecting themselves from contaminated surfaces by touching their faces, mouth, and eyes, and also to prevent someone who may be carrying the virus from infecting you, because we do know it's droplets, and if you can catch the droplets within the mask, we would reduce the spread. So social distancing does work, and I still think we should practice it.
Quickly before we wrap up this interview, there's been concerns with regards to issues of insecurity in the state in recent days. I wonder how the state is addressing that as well.
Well, in Ogun State, we have patrol trucks going around, over 150 patrol trucks going around the state. And I'm sure recently you've seen the commander of the police out on the beat, and 150 people were arrested and paraded with their weapons. So there's a task force, security task force within Ogun State. It's trying to ensure the safety of the people.
All right. Let's leave the discussion here now. Dr. Tomi Kyoka, thank you so much for joining us on TVC Breakfast.
Thank you for having me.
You're welcome.